We are going to talk about another very interesting topic, and thank you to the previous speaker for all the insights around AI, hospital, and so on. We now move to the pharmacy setting. My name is indeed Martino Canonico. I'm the director of the EU office for the EAEP. The EAEP is the association representing the online pharmacy sector in Europe, a relatively new sector, but one that is growing fast, of course, due to the uptake of the internet era. Let's start by quickly going into why are we talking about an organization representing the e-pharmacy sector? Why do we talk about e-pharmacies at all? Is one of the topics that we are going to address later on as part of the slides. First of all, our mission. Our mission is to really create complementarity between the offline and the online dimension. When you talk about pharmacy, nowadays we are still very much used to the idea of going into the physical brick-and-mortar pharmacy everywhere in Europe. In some countries, of course, the idea of online pharmacy is developing further and faster compared to others. But really, the patient nowadays is exploring accessing to health, to medicine, to services, to advice online. This is something that is happening regardless of what the regulation say, because the technology is already there and because the behavior, especially after COVID-19, is one that leads the patient towards going online. So key mission, of course, is to create complementarity between these two worlds. It's not easy because of some conservative approach that we still have to digitalization, especially in healthcare. This is one of the references that I also heard from a previous speaker as well, and we still very much face these when it comes to the pharmacy domain as well. Second key mission is to showcase how digitalization really strengthens the healthcare system and what can be done to make it more efficient, effective, but also what can be done to make the patient at the center of the healthcare system. Nowadays, this is what the sector, or partially what the sector looks like. The organization represents 37 online pharmacies in Europe. These are small and big pharmacies that operate either across the country where they are based or also across borders in Europe, depending on, of course, the size. We represent currently 23 European markets, and we all have one common DNA. We're going to talk about this a bit better later on, but the common DNA is really to believe in the power of digitalization to make healthcare accessible for every single person, regardless of where they live, regardless of the time, regardless of the struggle that they are facing, and of course, with an aging population, with chronic conditions that are more and more at the daily basis of the life of people, this is very much important nowadays. Let me jump right into what is an e-pharmacy. Maybe let's run a bit of an in-house survey. Who among you is familiar with exactly what an online pharmacy is, or who's been using it at least once in life, just to understand maybe what is the level of knowledge of the topic? Okay, quite some hands. Of course, we have the roundtable and the question later, but just to give you an idea of why are we talking about an online pharmacy and what is it exactly? An online pharmacy, first of all, is just like a physical pharmacy. It's actually a physical pharmacy because the requirement by law practically everywhere in the European Union is to be linked to a physical store, a physical pharmacy. So there's no difference whatsoever. The only difference is in the way the service is offered to the patient, and this, of course, happens digitally. The patient can either upload an e-prescription on the website or on the app of the pharmacy, engage with the pharmacist in counseling on either interaction checks on making sure that the medication, the e-prescription for that medication is correct, making sure that there's no conflict with previous medication history of the patient, and getting any other type of advice digitally from the comfort of your home, your work, your office, anywhere really due to the digital service. The medicine is then, of course, checked and shipped in accordance with all rules at the European Union level and at the national level, of course. So really, there's no difference in the way the medication is received by the patient. It's the same medicine that you can also find at a physical pharmacy, of course. I would also argue that it actually goes beyond what we are normally used to do in a physical pharmacy, because when you engage in a digital environment when it comes to pharmacy services, you're also then involved in more collaboration with the pharmacist after you've received the medication. And there's really some groundbreaking solutions that our members offer, and you really have to check it. It's about apps that remind you when to take the medication. It's about apps that help you understand better from an information point of view how to use a certain medical device, how to discover more information regarding to the condition that you may have, which can be a chronic condition or any other type of condition. So there's this concept of continuity of care, which is really at the core of the digital service that in the pharmacy can be offered. And there's, of course, the whole topic, which is very important nowadays, of really adherence to treatment and ensuring this, because we know by data from the European Commission and from different ministries of health that non-adherence to treatment is causing, of course, hundreds of thousands of premature deaths every year in Europe, but also it's causing a lot of costs to the healthcare system across Europe. So this is what an e-pharmacy is in short. Let's move to why are we talking about e-pharmacies nowadays? What is the relevance of these? What is the potential of these? Maybe we can start from this concept that we like to call the 3 A's, availability, accessibility, and affordability. These are the really 3 key elements at the basis of the e-pharmacies in Europe nowadays. Why availability? Of course, because when you go online to an online pharmacy, you can really have a clearer overview of what is available in terms of medicine. In times of medicine shortages, and we all experience these regardless of where we live, it's important to have this overview of what is available, and it's important to have access to your medicine at any time when you need them. It's not always the case. We know this when we go to a physical pharmacy. There is a bit of a limit that digital tools can help us to overcome and give a complementary option to your physical, regular, traditional way of accessing your medicine. Accessibility, also in this case, our members really collaborate on a daily basis with people that live with mobility issues, people that live with many chronic conditions, people that live in rural or remote areas. And for these people, it's really difficult to access the advice of a trusted pharmacist. It's really difficult to access the medication that they need when they need it. Maybe you go to a physical pharmacy to check for your medicine. The medicine is not there. You need to order it. It's going to arrive the day after. You need to go back 20 kilometers at home, 20 kilometers back to the physical pharmacy the day after. We don't all live in Berlin, Brussels, Madrid, or so on, where there's many physical pharmacies. And this accessibility part is really key to millions of patients in Europe. And then there's also an element of affordability at the end of the day. Of course, due to the economy of scale, most of our members are able to offer medicine at a price that is more convenient for the patient. And of course, this is one of the key objectives of the European Union, to make healthcare more accessible. And I also liked one of the words that was used by a previous speaker, democratizing. And I think digitalization really helps to make access to healthcare more democratic for everyone and possible everywhere. The numbers, of course, it's always good to consider the footprint of the sector nowadays, and this comes actually from a report that we published last week and looks at the growth of the sector in 2024 vis-a-vis 2023. Just a couple of numbers to give you, a bit of an overview of what is it that we are talking about when we talk about an e-pharmacy sector. The sector in 2024 grew to 12 billion euros. In 2023, the value was 10 billion euros. So there was an important growth, which is continued even after COVID-19, which was, of course, the main accelerator of digital services also in pharmacy. Germany being the leading market there. And then we have, of course, UK, Sweden, Italy, France, and many other EU countries. We have a few ones considered here, but more will be presented also in the following reports in the next months and years. There's 3 key trends that I want you to bring home whenever you think about digital pharmacy nowadays. One is the widespread adoption of e-prescription across Europe. Nowadays, and with Germany finally introducing e-prescription last year, in January 2024, we have all EU countries that have e-prescription system in place. This creates, of course, the conditions for any patient to just upload this e-prescription on the pharmacy website, to send it to the pharmacist, and receive the medication at home in all convenience. There's no anymore, I would say, barrier to accessing healthcare and your medicine digitally with e-prescription. Of course, patient summary and the accessibility of patient summary for pharmacists is still limited. This is something that we're also working on, and that would complement this overall medication overview for the pharmacist whenever they provide the medicine online to the patient. There's a European health data space. I'm happy to then dig deeper into this topic later on. I already touched upon this topic with a colleague in the room earlier. This European health data space is a regulation from the European Commission that entered into force in March this year. We worked on it, and it's really groundbreaking. It will change the way people access healthcare digitally, regardless if it's in a hospital, at a doctor's office, in a pharmacy. It's going to make e-prescription free flow across Europe without any barriers, with a standardized European format. It's going to make health data of the patient available to any healthcare professional, doctor, nurses, pharmacists across Europe, no matter where the patient comes from. So a patient from Poland traveling to Portugal, to Greece or so on, can then share their health data with their healthcare professional on site, and can have access to the whole medication history, the e-prescription, and of course this then creates further condition for medication adherence. There is a regulatory momentum in place as well. Of course, policymakers and politics are understanding, especially after COVID-19, that digital is an opportunity for everyone to access healthcare, and for those that before were actually struggling to have this type of access. So these are the three trends really shaping this growth. We expect the sector in 2025 to continue this important growth. Last year, it was an average rate of 14%. But again, the continued proposal of new digital solutions in pharmacy, but also in other settings, are going to drive this growth even further in Europe. Because at the end of the day, as I always say, this comes from the patients. It's the patient that is asking, that is demanding for this service to be available, to have access in a convenient way to healthcare, and it's really something that comes from the citizens. So there's no way to stop this further development online. What are the three topics at the core of this overall debate and at the core of the business idea of digital pharmacy nowadays? I mentioned three here just to summarize a bit what we are working on and what the sector is facing nowadays. First, and most importantly, fight the discriminatory treatment that we are still facing as pharmacies operating digitally because of the topic that we discussed earlier as well, so the conservative approach to digital solution in the healthcare setting and in other settings as well. So we are really trying to work on creating this level playing field to make sure that the rules on reimbursement, the rules on what can be accessed by patient online and so on are the same offline and online. Of course, with the same regulation, the same standards, but this is already the case. Whereas the possibility for patients to access services in pharmacy digitally is not the same. In some countries, as we'll see in the next slide, you cannot access your prescription medicine based on a prescription, which doesn't make any sense, because if you have an electronic prescription, why can't you have access to your pharmacy digitally and order that prescription medicine at home? So this is a key topic that the e-pharmacy sector is still a bit struggling with across Europe. Secondly, the need to really not only liberalize the access to this prescription medicine, but really making sure that everyone have the same condition in accessing this prescription medicine. Again, we talked about e-prescription, but in some countries, some patients only access OTC. In some other countries, they only access even fewer categories of products that you can find in a pharmacy. And this, of course, needs to change. And thirdly, and lastly, of course, we need to speed up the spread of telehealth, telepharmacy services. And this is another important part for us. It's not only about giving the medicine to the patient. The pharmacist is shifting away from that role, both offline and online. The pharmacist is becoming more and more the kind of frontier, first step for the patient to access healthcare. We are gaining more services, more power when it comes to, of course, not prescribing or not everywhere in Europe, but in giving access to certain services to the patients. From UK all the way down to Italy, there's programs in place to make sure that the pharmacist makes best use of their time to really support the patient and not lose time in administrative stuff, in following things that are not really relevant for the patient. So we're working on how telepharmacy, which is different than telemedicine, of course, can help support medication adherence, providing more advice online to the patient so that the patient doesn't necessarily have to go physically to the pharmacy, or maybe overburdening the hospital acceptance room, and so on and so forth. So there's really a lot of information that we also publish on our website on this topic as well. You may be asking yourself what is possible and what is not possible for a patient in a digital pharmacy setting nowadays. And we have this nice map, which unfortunately still looks a bit too yellow to my liking. We're trying to make it as green as possible. What are we talking about? In yellow, you see the countries where patient can only order and access through online pharmacies OTC medicine, so medicine for which you don't need a prescription. In green, you see countries where the patient can also access, besides OTC, prescription medicine, so RX medicine. Germany is one of those, and as we saw earlier, the largest market by far in Europe, also Sweden, a big one as well. But there are some big countries in terms of size, France, Italy, Poland, Spain, where the system, the healthcare system, still is a bit reluctant from opening up this option to their patient and to their pharmacist to really help more and more people. So we're really trying to update this map, to work with the Ministries of Health, to work with the European Union, to make sure that every single policymakers understand the relevance of this service, the home delivery service or online order service for patients, because there's really no justification for not allowing this. A patient in France, just across the border from Germany, doesn't have the same right compared to a patient in Germany to order their medicine. And this is, of course, not acceptable if we are talking about a European Union, a European Health Union, a Schengen area, and so on and so forth. So this is the picture of nowadays. There's a lot of talks and debate whenever you read about the online pharmacy sector, about the scare and the concern of the sector overtaking the physical brick-and-mortar pharmacy area. Of course, this is not the case. The online pharmacy business will always complement the physical provision of healthcare at the pharmacy. We have a few numbers as to what is the market share of online prescription medicine in the countries where this is, of course, possible, where the online sale of prescription medicine is available. You can see that in some countries, such as Sweden, it's a bit more advanced, around 16%. But all in all, the market share is still quite low. Of course, the uptake of a prescription is going to give a bit of a boost to this, but there's no reason whatsoever to be scared as to the fact that, in the future, it will always be a digital e-commerce service rather than an offline one, because this is, of course, not the case. It can represent, again, a complementary option for people that are struggling with mobility issues, chronic condition, living in rural areas, to complement their physical care. And this is what digitalization is about at the end of the day, making life of people easier and more convenient with the existing technology. At the end of the day, as I said earlier, it's a patient that is asking for this, and we have a nice study which was published a few months ago from Copenhagen Economics, a large research agency based in Denmark and collaborating with the European Union. And if you go check, scan this QR code, and maybe on your way home, you can read a few of the findings of this report. It's amazing to see the percentage of population that would like to have access to healthcare digitally, and that is in need of that for a number of reasons, which are listed on the report. In this report specifically, we considered 2 countries where it's possible to access all pharmacy services online, so Germany and Sweden, and 3 countries where this is not yet possible, Italy, France, and Spain, of course, a bit more conservative when it comes to access to healthcare. During this report, it's really about the patients and what they want, and it's always, for us in the healthcare system, about patient centricity. So it's important that we keep in mind this trend, because more and more in the future, we're going to see the online pharmacy sector developing, and it's exactly because of these requests, these demands, and the problems that these patients are facing. This is also leading to a growing coalition that we launched last year, a coalition of patient organizations that is really advocating for access to any type of medicine and any type of pharmacy service at home. It's called On Home Alliance, and it stands for Online Order and Home Delivery of Medicine Alliance. We realized that we are struggling to convince the decision makers in the healthcare domain that this service is of course needed and is a positive side of things for the patient. So we said, why don't we make sure that it's a patient that is asking for this. It's the voice of the patient that is representing there, because at the end of the day, as I said earlier, they are in the most powerful position to bring along the message. This coalition is growing extremely fast now. We have almost 40 patient organizations, cancer patients, Parkinson's patients, healthcare managers, and any other type of coalition and patient organization at the national level supporting us in this fight. This is coming more and more to a situation where we will, of course, see not only the sector recognized at the national level, but more services accessible and available to the patient at the national level, also because of this important coalition working on adapting EU and national rules, working on chasing decision makers, and really showcasing the fact that a person living in the suburbs of Italy or in the suburbs of a larger city in Spain doesn't have the same right to access healthcare as a person living in the capital, of course, where there's hundreds of pharmacies all around. Having said this, we are also, and this is something that I wanted to mention already and happy to respond to other questions as well, we're also organizing a major summit which is going to take place in Athens in Greece next year. It's going to be the third edition, fully managed by the EAEP. June 2026, we are going to dig deeper into the way e-pharmacies collaborate with not only manufacturers, but also market partners such as platform providers, AI services, omnichannel players, technology providers, to really bring all these issues forward and to help each other to advance the sector. And at the end of the day, always with a focus to making the healthcare system more patient-centered, because currently, this is not the case. We are still seeing a lot of discriminatory treatment, as said earlier. This is one of the forums where we try to network with each other and bring forward this message to the patients, but also to the businesses and to the policymakers. So, coming to an end, if you have any questions or if I sparked your curiosity about anything, feel free to ask. Otherwise, I'll also be joining the roundtable in a few minutes.